Hello there, you're with the Birth Whisperer. My name is Anna Wild, and it is my mission to support you to discover the courage, calmness, and confidence that you need for giving birth. Today, I want to talk about doulas. Why would you bother having a doula when you have a loving partner or husband or a midwife or an obstetrician, and maybe it's their job to support you and take care of you and give you everything you need in that journey to meeting your baby. I wanted to find out much more about the impact of having a doula at your birth, and so I thought I'd find a global expert to talk with. Her name is Dr Amy Gilliland, and she's done a lot of research about what happens when you have a doula at your birth, and she's also researched female sexuality and conducts workshops on attachment and infant health. She's a psychology instructor at Madison College, Wisconsin, USA. So excited that she can come with all of her knowledge, working with hundreds of families over the antenatal and birth period, and share some of her wisdom and research with you today about the benefits of having a doula at your birth. I'd like to welcome you so much today, Amy. Really grateful to have you along and that you can share your wisdom about doulas today.
Thank you. I'm really happy to be here, Anna. I'm really excited to be able to talk about such an important topic.
Fantastic. So I thought we'd just blast right into it. And I wonder if you can explain what is a doula and what do they do? Because I know many people still are not so aware of doulas.
Well, I think the place where it starts with doulaing is kind of having this idea that what happens during birth is important and it's private and it's mother-centered or it's couple-centered, and people's expectations are that, well, when we get to the hospital, the nurse will tell us what to do and give us suggestions, and we'll be able to be on our own and everything will just flow well. And that's not usually what happens. Is first-time couples make those assumptions, and they get there and they realize, oh, the nurse isn't rarely here. I mean, unless you're in a really small hospital with a high nurse-patient ratio, most nurses have 2 to 3 patients to take care of. And even if they are doing one-on-one nursing, they have a lot of responsibilities that are unrelated to that particular patient. There's other record keeping and unit responsibilities they have to do. And so they'll usually spend about 5 or 10 minutes with a laboring couple or laboring mom, and then they're off to something else. So you don't have that one-on-one care. And the same thing if you're seeing a midwife. People expect a midwife will be spending a lot of time with them, but usually that's not true either. So there's this sense and then when a woman begins to really experience active labor, there's a lot to do. If she's got back pain and or needs help getting into position and she wants somebody to hold her hands and look into her eyes, there's no way one person can do that. So the doula entered, and I've been doing this. I went to my first birth when I was 20. I'm 53 now, and I didn't know anything then. And when I started going to births professionally, I was 25, and I learned. I'm looking at this longitudinally. I've got this real long perspective about what is it like to give birth at home and what it's like to give birth in the hospital. And so the doula's role has evolved to fill in those blanks, that she will make suggestions for comfort measures, follow mom's cues about what positions are most helpful to her with whatever experience she's having. With partners, we make it so you get to do whatever you want to do. If you want to be really involved, we will go fetch the popsicles, shut the door, flush the toilet, get something out of the baby book, pull back her hair, give you chapstick, rub your shoulders. We do all that stuff so you just get to focus on being with the laboring mom. And if you're a partner who's more squeamish, or you're like, in my studies that I did of parents who, what their labor support experiences were like, both with and without a doula, the dads would often say, I'm really no good at comforting her when she's upset in our regular life, what makes people think that I'm going to be able to do that, when she's in labor? Or I don't like all that kind of gooey, fluidy, I'm kind of squeamish. So in those instances, the doula can do most of the hands-on stuff, and then the partner's free to enter in and be loving and caring and encouraging, and then take that step back. So I think there's the labor support helpful role. I also think there's the couple support helpful role. And I also feel that there's also this feeling that partners, and especially men, their developmental experiences of becoming fathers need to be honored, and that they really need a lot of support. And in most Western countries, men's needs have always come at the bottom. They've been told, you don't matter. She's in labor, and yeah, you might have feelings. Yeah, this might be really, really hard for you to see her in pain. But, we really don't care because she's in labor. And men have absorbed this and internalized it and come to this conclusion that I don't matter. And they leave births feeling really frightened. All of the research that we've done, and I've read everything has been published since the late 1970s in this research project that I did. I read everything. It shows that men are anxious, frightened, scared, wanting to flee, and feeling out of control. And it's super challenging to see women in labor and struggling. Even if they're coping well, they still don't look like they're coping well because they're moaning and screaming. She's not her normal self. And just to have somebody there that says, this is all right. Women in labor act like this. Here's what you can do if you want to be more involved. Or do you want to take a cigarette break? You can do that. It's all right. And just to have him be tended to, and not to let those anxieties and fears get out of control. I'm almost at the point where I think doulas do more for men than they do for mothers in labor. I really do. And in that way, they really salvage the relationship. Birth becomes less something you have to recover from that's more traumatic than something that you went through together and now we've come out the other side together.
Right.
So that's what I feel that doulas can offer. And there's a lot of words. I can say it in an elevator talk, but I think you wanted the long version.
Right. So, I hear you naming also this calming presence that's going to have an impact on everyone who is there, and I think that's huge. So you've named quite a few aspects of how doulas help, but you've done a lot of research too, I know. So can you just name very briefly the proof that it helps in terms of outcome?
Yes, in terms of obstetrical outcomes, what are observable, measurable obstetrical outcomes is that labors are shorter by at least an hour for first-time mothers, that women experience less pain, they request epidurals less often, and on the pain control scale, they indicate their pain the same whether they have an epidural or whether they have a doula. So that's well documented. We've got studies that show that women are less likely to have interventions, especially Pitocin, for augmenting labor, which is different than for inducing labor. So Pitocin for augmenting labor, they're less likely to have vacuum extractors or forceps used, which is also related to the fact that there's fewer epidurals. So because epidurals are kind of tied in with those. And thus when fewer interventions are used, then we usually end up with a lower cesarean rate. So there's higher rates of breastfeeding initiation and higher rates of exclusive breastfeeding at 6 weeks when women have had a doula. And this all hinges on continuous care, so that the doula is with the mother continuously from when the mother wants her there until several hours after the baby's born. Now, why do we get those effects? There's a couple of different theories, one of which is my theory, which I believe it's related to meeting attachment needs. That whenever we as human beings have an experience that makes us feel vulnerable, frightened, or scared, such as labor, it's normal for us to reach out to someone else to help us feel more safe and more secure. Partners are not free to meet those needs. Nurses are not free to meet those needs. Doulas are the only people who are available to meet all of those needs for a secure base. And when those needs are met, there's no interference with the natural physiological brain processes of labor and birth. And that's what gets you a vaginal delivery. That's what gets you a shorter labor. That's what gets you more beta endorphins and more oxytocin, which is what gives you greater coping with pain and what also gives you good, strong, regular contractions that bring in your baby. So there's other studies that show that women feel their babies are better. Older studies that show when there's a doula present, women are less likely to experience postpartum depression. So there's that's what our evidence shows and why. There's also this whole oxytocin thing, but we can't ever measure oxytocin during labor because we can only do it with blood work, and that's such an intervention that counteracts being able to measure it in any good way, effective way.
Yeah. So, I mean, for me, the evidence is overwhelming, and I'm like, yes, of course, I'd want someone like that. I know that some couples would feel still like, oh, it's this really intimate personal experience, and why would I want to have a stranger there? And it feels a bit like intrusive.
Have they ever been to a hospital birth?
Yeah. So what would you say to that? Yeah.
I mean, that's the crazy thing. People think, oh, it's going to be like in our bedroom at home. It's like, no. There's one, maybe two doors. They're often left open. The lights are on. I mean, you can get up and turn off the lights and shut the door. But if you're helping her cope with labor, who's going to get up and shut the lights off and shut the door the next time? You know, are you going to keep leaving her and getting up to do that? It's like, no. The doula's role is to protect that space. So you and mom get to labor. And we're going to help create and provide and support that cocoon. You know, it's like you don't get that cocoon on its own, and the hospital is not set up to individualize care. The hospital wants to do things when they want to do things. You know, it's like you have to have this order in, we got to have this test, we want to come in and talk to you about this thing, because it's convenient for us. And so people's perception of what actually happens in the hospital and the reality of how birth goes in the hospital, that's where the disconnectedness in people's expectations. So once you start really realizing how things happen, oh, okay. Yeah. And just needing to be tended to when you're vulnerable. I mean, caregiving skills, caregiving is highly skilled. Being able to give care appropriately and sensitively, that's a skill. And not everybody has that.
Not all partners have that, right?
No, not all partners have that, and not all nurses have that. Some do, and they love that part of their job. But most nurses don't. They like the techie stuff. They like babies, you know, but that whole hands-on, let's get in close with all my patients, it's going to happen with some, but it's not going to happen with most. So I think that's where that's the disconnect is between the perception of what birth is going to be like in the hospital and the reality of what birth is like in the hospital. And usually it costs them their first birth. And then the most popular doula client is the second-time mom and second-time dad or parents because the first birth didn't go the way they thought it was going to. So
I think they really realize that having that emotional support is absolutely essential, and that their care provider, it's not their job to do that, and that yes, sometimes you might get a midwife who's a more caring type, but not necessarily.
Right, you hire them for medical care, and you want that given in a compassionate way, and you want them to listen. So what the doula can help you with is to identify, what are your priorities? What's most important to you? And then how to communicate that effectively, when you're in labor and you're dealing with so many different people. I live in a town where there's a medical school. So we've always had medical students, nursing students, and residents. And because of that teaching atmosphere, it's nice to be able to get the students and the residents when they're still flexible and they see what we do or the positions that we do. In the United States, according to the Listening to Mothers Survey 3 that came out in 2012, 70% of women don't get out of bed. They don't move around during labor. They don't use positions to help deal with the pain of labor. I think the number was actually 64% stay in bed, and which is just astounding. But if you get into bed and you have a vaginal exam and you're hooked up to the monitor, it takes effort and knowledge to be able to get out of bed and say, oh, I should get up and walk around. Because if it starts to hurt, when something hurts, you want to stay put because it might hurt more if you move. So somebody's saying, let's try this. Let's get in the tub. Let's walk around. Let's just lean over the side of the bed. How about we have a popsicle here?
So, Amy, how can a couple find a doula that really suits them, that's going to be a good match and that's going to work well in the environment and with the other people involved, whether it be a doctor or a midwife? How can they find a good fit?
I think the first thing that happens is it's not going to be, well, I'm imagining that there are websites that people can go to find doulas. So we're making that assumption. And the next thing is, you know why women choose doulas? Women choose doulas because it's somebody they feel safe with. It's like, oh, I could be naked with her, because you will be. Yeah. But there's this feeling in your gut about, I could be myself with her. I trust her. I can relax with her. And that's something that usually happens in the first 5 minutes. Is like of talking to somebody, you just kind of have this sense of like, oh yeah, I could do that. She seems like a caring person. So it's nice to have, to look at a doula's experience level. It's nice to look at her background. It's nice to read her testimonials. But the thing that makes the woman choose the doula is because of that feeling of safety and trust. So, and then as they build their relationship with one another and that sense of rapport over prenatal visits, then they'll continue to receive more information and hopefully that trust will grow with the doula. So I think that it's important for parents to consider whether the doula is certified or not and who she's certified by. And this puts the onus on the consumer to do their groundwork about the doulas that are in their community. Some doulas are great doulas and never certified. They've been to like 200 births. It just wasn't important to them. Other doulas want to stand by a scope of practice and say, this is what I do, this is what I don't do. And that can be very reassuring for families and for parents too, to know that, oh, there's a grievance procedure here in place. If I don't like what you did, there's somebody who will listen to me about that. And I think testimonials are good, talking to other parents. What did you like? What did you not like? And sometimes those are things that are available on people's websites.
Great. Thank you so much, Amy. It's just been a real pleasure talking about doulas, and yeah, really excited to share this information with women who may not have considered having a doula before.
Well, thank you. I really appreciate you asking me, Anna. Mm-hmm.
Thank you so much for watching. If you've been inspired, please share, because your voice supports respectful, positive childbirth for all mothers everywhere. Make a comment, send this link to your friends, post on Facebook, and sign up for more birth wisdom that I share in emails at thebirthwhisperer.com.